meeting was a difficult meeting, frankly, to sit through, because we heard story after story of clients of home care, of service providers in the home care system, of family members of people that were receiving services, who all told the same fact story, which was the services are being cut, the services are inadequate, the CCAC has been not responsive in terms of complaints and concerns when those services are being cut, and people feel frustrated, they feel angry, they feel worried, and they feel very, very vulnerable. This is not a home care system that is working, and it's shameful that Premier Wynne and her health minister refuse to even acknowledge that their health care system, that their home care system is not meeting the needs of Ontario patients.
Now, this roundtable here, what do you hope to accomplish with this? Well,
you know, I said to the people in the room today that I very much respect their coming forward publicly. You know, people like to keep their personal health issues private. That's an important, I think, value that many people have. But they are very courageous, and I thank them for coming forward because they told their stories. We're going to take those stories to the Ontario legislature. We're going to continue to pressure the government, to pressure the health minister, and to get the Liberals to actually start paying more attention to the needs of patients in Ontario, and not do one thing in the legislature, which they do. They talk a good game. They talk about healthcare transformation. They talk about what a rosy picture the healthcare system is. Actually, they talk about how much money they're throwing into healthcare, but the reality is not the same on the ground. The reality is not the same for the patients. You can't say one thing to the cameras and then turn around and do the exact opposite. To the cameras, they say everything's great. We're spending more money in healthcare. There are no cuts. People aren't having reduced service. But then when you talk to people in the community, the exact opposite is happening. And that's unacceptable. That's duplicitous, and it's inappropriate, and in fact, it's causing people great, great suffering. So today's roundtable is going to help us to continue to advocate for patients in the legislature.